Scientific research and development have dominated talks here at the 4th G20 Health Working Group meeting here in Johannesburg. To discuss more about why scientific research advancements are critical to preparing for future pandemics, I have with me Professor Farid Abdullah from the South African Medical Research Council. Thank you for making time.
Pleasure.
We wanted to find out more about this Global Commission for Science and Medical Research that South Africa and the World Health Organization are keen on. What is it about and what will it do for South Africa?
So medical science and medical care is exploding with new technologies, the use of artificial intelligence, genomics, all sorts of things. And we want to make sure that no country is left behind, and that countries in the south work with countries in the north to make this available to everyone. Robotic surgery, precision medicine, and the commission that we are proposing is to get the G20 countries to collaborate with each other in these scientific developments, because these are developments for human progress in general. And the sooner we all get access to these things, do it better, the better. And in order to do that, we need the Commission to discuss and talk about these things together.
I wanted to ask you about the scientists. We saw with the COVID-19 pandemic that there was a lot of research that was informing policy guidelines. What do you think needs to be done to create more synergy between government officials and scientists so that we have more evidence-based and data-driven decision-making?
So COVID was a good example, and South Africa was a good example of how government listened to the scientists, followed the advice from the scientists, and whilst the scientists were doing all this incredible research, government's ear was immediately available to change that into policy. That didn't happen in a lot of countries, and so a big part of the discussion today was to get scientists to work with governments and governments to understand that the scientists need to be given their ear to guide them on what to do when it comes to implementation.
This new commission on advancing research, medical research, where to from here after the G20 meeting?
So it depends really on what the other G20 countries are saying and doing, and most of them are supportive. That will then go to the G20 ministers meeting in November, and a recommendation will be made there to have this commission. If it's agreed, then the WHO will set up this commission with multiple countries leading it, and then we'll start actually talking about how to do this collaboration practically.
How has research in South Africa been affected by the US funding cuts? It has been quite a contentious issue, and we've already seen how important research and development is.
So that's a very good question, Zandi, because 70% of medical research in South Africa was funded by the US National Institutes of Health. And what we've learned, and we talked about it today in the G20 meeting, is that we need not one country to bear the burden of funding medical research, but we need all countries to step up to the plate, including countries in the north and countries in the south. So that once we have a better distribution of investments, more investments, we will find quickly that we're all moving together to a better world for medical care and for scientific discovery and development.
That was Professor Farid Abdullah from the South African Medical Research Council. The 4th G20 summit here in Johannesburg continues, and the discussions around science and innovation continue. Zandi Myeza, SABC News, Johannesburg.